or false, Dr. Gunter?
Yeah, so hormones are never in balance. That's kind of like a quasi-wellness TikTok, Instagram, I want to sell you a supplement phrasing. At best, it's a bad analogy. Hormones are like a symphony. They're changing all the time, and every day each one's playing a different role. And it's just not about balance. It's just not an analogy that works.
Library was my space, and there was just so much.
To the harbor race excursion with the boys to have a time.
Okay, Dr. Gunter, so excited to be sitting here with you. I know we just did a podcast together on my show, and people were raving about it, so it's just an honor to be back here sitting with you again today. I don't think I'm alone in saying I'm part of the Jen Gunter army. Do you know what I mean? Because there's a lot of us out here. I bet you this audience is full of them, and we love you because you are, can I swear here, Elspeth? You're the no bullshit doctor! And there's so much going on right now, especially online, and everybody seems to be an expert, especially on TikTok. So you're here to cut through the BS, and so we have a lot of noise to cut through as well. I just want to make sure, is that my mic? Am I breathing too heavily already? Is that okay? We're good. Excellent. Okay, so tonight we are going to be talking about menstruation, menopause, misinformation, misogyny, and a whole lot more. We have got a lot of questions. I've got questions for you. Audience, do you want to get involved a little bit as well? Put a bit of your knowledge to the test? So from time to time, I will take a look at you and throw some true or false questions out before Dr. Gunter answers them. Of course, only at your will if you feel comfortable to participate. This is a safe space, no judgment, okay? So I want to put that out there as well. I want to start with why you decided to write this book, Blood, and also for whom did you write this?
Well, first of all, I wrote it for everybody. I wrote it for everybody who's ever wondered, like, what the fuck is going on, which is a lot of us. So for that reason, but I also wrote it because everybody needs to know about the menstrual cycle. I'm really sick of people feeling shame about their body parts. And, I touched on that with the Vagina Bible and also with Menopause Manifesto, but really this seems to be the root of the shame, the whole sort of weaponization of the menstrual cycle. And I wanted to see the word blood everywhere. And so thank you, everybody in Canada, for making it the #1 nonfiction book.
Yes!
And everybody needs to know about the menstrual cycle because we're all here because somebody had a menstrual cycle, right? Every single person in this room has personally benefited from a menstrual cycle. And yet only half the population is punished for it. Yeah.
Preach on that. Yeah. So you start the book with outlining why, out of all the mammals on the planet, we are part of the lucky 2% that actually menstruate. I think there's us, the rhesus macaques, maybe some baboons, I don't know. So why are we part of the lucky 2%? Why do we menstruate?
Yeah, so this is one of these age-old questions. So there's us, there's some primates, there's the spiny mouse, the elephant shrew, and some bats, right? It's like a really odd combination. And so actually menstruation, we believe, evolved 4 separate times. So for us and the apes together, and then, the bats and the elephant shrew and the spiny mouse, so it's all separately. And it's really about resource curation and producing the next generation. So menstruation is involved with changes in the lining of the uterus called spontaneous decidualization. And this thickening in the lining of the uterus is there basically to act like a catcher's mitt for the embryo. So human embryos are incredibly invasive. They burrow very deeply into the uterus to make contact with maternal blood vessels for oxygen. Our big brains, they need that oxygen, right? The way we grow. So you have to have a thickened tissue that can handle that. And in addition, the decidua actually acts a bit like a sensor, like a quality control for embryos. And everybody here has probably heard, or many people have heard, that about 70% of very early pregnancies end in miscarriage, and that's because of the decidua, making sure that the ones that make it through have a better chance of survival. Because human pregnancy, I don't have to say this to anyone who's ever been pregnant, is a huge biological load on the body, right? So you have the 9 months of pregnancy, you have the childbearing, you have breastfeeding, and then you have the amount of time it takes to get a child so it can feed itself. So to use all those biological resources in a constructive way, menstruation or the menstrual cycle helps us with that.
So you say that learning about menstruation is not about blood, it's not about periods, it's about patriarchy. What does that mean?
Yeah, so the reason why so many people have so many questions about the menstrual cycle that they think, what the fuck, like what is going on, is because of the systematic oppression about the menstrual cycle not being studied appropriately, or when it's studied, it's in the context of getting pregnant. That, that we care less about the lives of people outside of pregnancy than during the 9 months when they are pregnant. The fact, the shaming about it, right? When you can't learn about what's happening to your body, you're always off balance, and that's a really good way to control half the population.
Oof. Okay, does anybody know what the word, just case in point, you talk about this in your book, does anybody know what the word, or I guess the origin of the word penis and what it means? Does anybody know about that? Okay, well, why don't you tell us, what does penis mean, where did it come from?
Yeah, so it means sheath. Oh, no, so it means scabbard, like a sword, right? Like as if,
It's a sword, yeah, as if.
Yeah.
So conversely then, what does vagina mean,
Yeah.
and where did that come from?
Yeah, so vagina is for sheath, right? So the sword in the sheath, right? I mean, it's very awful.
So medieval.
It's so awful, yeah. And so many of the terms that we use have that origin. And, and doctors today don't learn Latin and Greek, but, the ones that trained me probably knew it. And when we have all these words that have awful meanings, and this is what doctors are learning, it's got to have some kind of impact on people.
Yeah, absolutely. Okay, first audience, true or false? This is all information in blood. Having your first period means you become a woman. Okay, yeah, it's false. So that is one of these sort of myths that is perpetuated, this idea. So set us straight.
Yeah, so it's really awful for us to be thinking about like 10 or 11-year-olds as becoming a woman, right? Like that's just, that sets us up for all kinds of awful discussions and awful permissions in society, right? Like child marriage and all these forced marriages. So no, I mean, it just means that you're menstruating. That's it. It's not any kind of ascension into anything else. And of course, it's celebrated because, your only value is your ability to reproduce, right? And then of course, when you go through menopause, then you can't reproduce anymore, so you lose value. And it's really, it's a very reductive way, I think, to think about half the population.
Okay, true or false? The age of our first period correlates with the age when our mothers had their first period. Ooh, yeah, that one's a bit, there's a lot of falses. What do you say, Dr.
Yeah, so it's not that, there really isn't a good correlation there. And so we don't have a really good way to predict, when people's periods are going to start.
Okay, next one. Our periods are controlled by the moon cycle. Somebody on TikTok said so it must be true, right?
I know that comes up a lot, and obviously people are free to think about their own personal body in the way they choose, right? That's fine. But no, the lunar cycle does not have any change on your menstruation. Otherwise, we'd all menstruate at the same time, just like the tides all happen at the same time, right? And that's something that would be really obviously disprovable. So the thing is, it comes from the idea that, the word menstruation comes from the Latin for month, which is also, related to a lunar month. But it doesn't mean that the moon dragged you into menstruation. It means that this is something that happened with a cyclic occurrence, like the appearance of the moon.
Okay, true or false? If you follow Dr. Gunter on Instagram, you already know the answer. Menstrual bleeding is a detox.
Yeah.
Isn't that your favorite?
Oh, I hate that one because it basically takes us all the way back to like 3,000 years ago. Because that's what the ancient Greeks thought about the body, that, women had inferior physiology, that we were, getting rid of toxins that we couldn't handle other ways because we were shoddy construction. So that's why we needed menstruation, right? Men were in perfect balance and, obviously women were not. And menstruation was proof of that. So it's really awful because it ties into the whole, women are dirty, menstruation is dirty, it's toxic, you're polluted. There are, throughout history, people have linked menstruation with vampirism, with rabies, with all different kinds of awful things. Even in the 1970s, there are medical professionals who actually believed that if you were menstruating, that you could wilt flowers.
Okay, I mean, it would have saved us a lot of trouble with a lot of the pesticide problems.
I
that
know,
we have
right?
Today.
I'm like, okay, so if we could ruin crops, that would be a superpower.
Obviously.
Right? You'd be like, hey, man, we're going to just take over this country, and if you don't let us, we're going to just get rid of all your crops.
Okay, does the regularity or the amount of blood flow or amount of menstrual pain that we experience, does it tell us anything about our overall health? Is it like a biomarker for health in general?
So I would say yes and no. And some of these things are a bit complicated. So if you're having heavy periods, meaning clots that are bigger than the size of a quarter, or you're feeling gushing when you're standing up, or you're leaking through onto your clothes, then that certainly could be a risk factor for developing anemia and iron deficiency, which absolutely could affect your overall health. If you have serious pain from menstruation, you could have a medical condition called endometriosis, or you could just have pain with menstruation. And chronic pain has an impact on the body. It can actually change the way you process pain. So all of these things can absolutely have downstream effects. And we also know when people don't take in sufficient calories, they can lose menstruation. And that's an important thing for us to know about, because that can also set them up for other health problems. So yes, it can tell us important things, and it just depends on the situation.
Okay, this one is also straight from TikTok. And I'm sorry, and Gen Z, I love you, but there's a whole movement out there like tampons are dangerous.
Yeah, so I have a couple of rules when I think about myths online. One is translated into men, meaning would they ever talk about a man's body that way? And if the answer is no, then discard it. The other one is it related in some way to purity culture, meaning you shouldn't be putting things in your vagina? And if you notice, wellness uses all the language of purity culture. Pure, clean, natural, returning to an unspoiled state. That's a really awful way to think about, a female body. Think about a body that menstruates. It means that, you're polluted if you are, damaging your quote virginity. There's a huge overlap with these sort of, ultra-left natural movements and the radical right. They really kind of go around full circle, and they match a purity culture. They're using the same language. Maybe they're for different reasons, but it's all actually control. So as long as a menstrual product has been tested and approved, by Health Canada, has, passed in the United States, then it's fine and safe to use. And, it's these panics come up really regularly. I mean, when I was a medical student, the big one they were trying to scare people about was that there was asbestos in tampons.
Ooh.
Of course not. There's a lot of thing about asbestos in the 70s, right? That's when we learned it was dangerous, but it's only dangerous if you inhale it. The whole idea was they believed that companies were putting asbestos into tampons to make you have heavier periods. But asbestos wouldn't do that anyway, but they're not in tampons. And it's been disproven so many times, and they just keep coming around, but that's what conspiracy theories do.
You rail in the book against the term feminine hygiene product. Okay, let's just woosah. So what's the problem, and what should we be calling them instead?
Yeah, I hate that's like nails on a chalkboard. So first of all, menstruating doesn't mean you're feminine, right? There are trans people who menstruate. There are non-binary people that menstruate. And do we really want to think of an 11-year-old who's menstruating as feminine? I just think that feminine is how you think about your body, and that's great. If you want to think of yourself the feminine, that is fantastic, but we shouldn't be assigning a feminine value to it. Secondly, it's not unhygienic. Hygiene has nothing to do with it. We're not trying to sterilize something so you can do surgery, right? So feminine hygiene, it's got this awful, undercurrent of dirtiness and purity culture and stuff again. And I just keep thinking about, imagine being 10 or 11 or 12 and walking through Shoppers or Walmart and seeing feminine hygiene. It's like the idea that you can't even say the word means that this thing that's going to happen to you is shameful. And then, of course, it's shameful because they're using this awful language to describe it. I mean, if you can say toothpaste, like that's what it's for, you can say menstrual products.
So call it menstruation products.
Yes,
Menstrual products.
menstrual products. Yeah, I personally think it should be illegal to call it anything else, like, because all these companies aren't changing. Like, you still walk in stores and you see it. So, I mean, you should just call it what it is. And, if you're ever in a store and you see it, go up and say something. Actually, they probably have never even thought about it. Or, the sign's probably from the 1960s and needs to be updated anyway.
Probably
Yeah.
right. Hey, what are your thoughts on period underwear?
Great, excellent. If you like it, use it. In fact, I went into, for the first time, there's a Think store, I think, here in Toronto. I was out of underwear. And so I went in because, I just thought I should check it out. And I thought it was really great to be in a space where they had period under hanging up. They had underwear for incontinence hanging up. They had exercise clothes that can catch urine for incontinence. And I just thought, that's really great to be able to walk into a store and just see it there. So yeah, I'm all for whatever menstrual product that is safe for you to use. And I think the fact that there are more options now than when I was menstruating is fantastic.
I love that. Okay, we're going to transition a little bit. It's a true or false question. Okay, audience, over to you. Our hormones are generally in balance as we go through our monthly cycle and if we're in good health, but they go out of balance when we are unhealthy or begin to enter perimenopause or menopause. Thinking. True or false, Dr. Gunter?
Yeah, so hormones are never in balance. That's kind of like a quasi-wellness TikTok, Instagram, I want to sell you a supplement phrasing. At best, it's a bad analogy. Hormones are like a symphony. They're changing all the time, and every day each one's playing a different role. And it's just not about balance. It's just not an analogy that works. And so, I tell people, there are definitely times when there are hormonal changes, like for example in the menopause transition, and it's really valid to say that hormones are chaotic during that time because they're not following the kind of the standard rhythms that they would follow. Similarly, during puberty, they're chaotic, right? Like, so it's a very similar sort of start and finish to the menstrual bookends, if you will. But balance isn't really a good language, and of course, most people who use it are trying to sell you a diet or a supplement.
Okay, let's go there a little bit because you dedicate an entire section of the book to menopause, which, listen, it's finally starting to have its moment in the sun. Can we get an amen for that? Oh, it's only taken since the beginning of time.
Right.
What's taken so long? And we are, as you are alluding to, we're already in these early days of big-time menopause talk, seeing so much misinformation, disinformation proliferating everywhere. And I think it's just being fueled by social media right now. So you wrote the seminal, my personal Bible, the Menopause Manifesto. If you haven't read it yet, please do. Who has read it? I presume a lot of people. Okay, yeah. Spread the good word. Spread the news. It was so groundbreaking in its clarity and its simplicity and just stating the facts and cutting through the bullshit. And so we're going to spend some time here because personally I'm in my perimenopausal era.
Welcome to the club.
Thank you. Thank you very much. It's a great club, by the way. It's a great club. I really want to try to rebrand this.
Yeah, we're always taking new members. We're not exclusive.
So you talk about this in blood. There must be some kind of evolutionary advantage as to why, even though we're part of that small 2% that menstruates, but this idea of menopause. So why do we even go through it in the first place?
Yeah, so menopause is even rarer than menstruation. That's what's super cool about it. Basically, the only other mammal that's been well studied that has menopause are toothed whales, orcas actually. And they go through estrus. They don't have a menstrual cycle that we know about. I think it's probably really hard to know if an animal in the water menstruates or not. I mean, I'm only imagining. I don't study marine biology, but just going there a little bit. So we believe the hypothesis is called the grandmother or the wise woman hypothesis. And evolution is always looking for the next generation. It's all about passing your genetics along, right? So whether you're, a flower, a squirrel, a human, it's all about making the next generation. Evolution is turning the energy from the world around us into the next generation. So how can menopause serve that? Because when you're in menopause, you're not making the next generation. Well, through a lot of research, what it turns out is menopause is genetics the long game. So when you're in menopause, you are someone who has experience. And you think about this, thousands of years ago, you would have had experience with childbearing. You would have had experience with looking for food, looking for water, all the things that it took to survive. If you got to be 55, you probably knew some things, right? But you could only be helpful to your children if you weren't encumbered with young children yourself. Right? Mm-hmm. So imagine if you have somebody in your household who isn't encumbered with childbearing, who can help you gather food, who can remember where to get water in times of drought, who knows where to get very specific berries, who knows how to build shelter. And so that's really the wise woman hypothesis. And studies have borne out that when there was a grandmother in historical studies in the household, that the sons and daughters both had more children. It wasn't just the daughters, so you weren't passing on genetics for having an easier childbirth. It was the actual help. And other studies tell us that in cultures where they don't participate in the modern society as we do, that a grandmother will spend 35 hours a week providing food for the family unit when her daughter is pregnant or breastfeeding, which is the bulk of the calories. And that's 35 hours a week of pretty hard work. And so it's really genetics the long game. Society is here because grandmothers help to offload the work so we could have more generations.
Amen for grandmothers.
And I always like to say that doesn't mean that we're defined today by having children or by being grandparents. We have really big brains, again, courtesy of menstrual cycles. Mm-hmm. And our big brains have let us go in all different kinds of amazing directions. And really everybody can be a wise woman.
That's amazing. I've heard some people refer to menopause as some in the framework of an illness or an ailment because they'll frame it as, quote, ovarian failure. Is it a disease, Dr. Gunter?
No, those people are misogynists. And look, women can be misogynists, right? I see a lot of that language from women on social media. No, I mean, otherwise, being a man would be a disease, right? I mean, well, we can argue about that all you want. But if you look at it historically, I mean, in the 1900, before menopausal hormone therapy was available, before there was anything available, women had a longer life expectancy than men. So you could say that not having menopause was a disease, right? It shortened your life expectancy, except, you have ethics and you're going to not talk about it in that way, which is not constructive. So, yeah, this whole idea that women died before menopause was introduced in the 1960s in the book Feminine Forever, which was funded by Wyeth, the makers of Premarin. And so it has absolutely no bearing. I mean, the ancient Greeks knew that the average age of menopause was 50, 51. They couldn't have known that if everybody died in their mid-40s. I mean, they just couldn't have. And then my answer to that is, so I guess there never were grandmothers or great-grandmothers? Nobody ever had a great-granny? Because when you're saying everybody died before menopause, what you're doing is erasing every wise woman in history.
Truth. Much like I asked you about the first time that a woman or a woman gets their period, is there any correlation between the age and experience of menopause for a woman in relation to her mother's experience?
Yeah, so no, that was actually studied. There was a really interesting study where they looked at sister pairing and mother-daughter pairing, because sisters share half their genetics and you share half your genetics with your mother. And what they found was your sister was far more indicative of when your age of menopause would be than your mother's age. And the thinking is it has less to do with genetics and more to do with environment, or it's environment plus genetics. Because your sister is more likely to grow up in a similar environment than you and your mother. This is different generations, obviously. So if you have a sister, that's more likely to have more bearing on your age of menopause.
Oh, that's really interesting. Okay, this is one of the fun ones.
Okay.
Can you just buy an at-home test to determine if you're in menopause?
Well, can and should are different words. There's all kinds of things you can do. Should you do it? I mean, only if you want to throw money away. I like to save my money for shoes, but each to their own. So no, so if you are over the age of 45 and you are starting to get hot flashes or irregular cycles or you're not sleeping at night, we're expecting you to have menopause. The average age is between the age of 45 and 55. So if that's happening at the expected time, we don't need tests. Just like if you got your period when you were 12, we don't need to test you. We didn't need to do a blood test to be like, why are you bleeding at 12? However, if you got your period when you were 4, then yes, you absolutely do need tests.
Yes.
And it's the same thing. So if your period stops when you're 42, or if your period stops when you're 38, or you don't have it for 3 months, that absolutely needs to be investigated. If you have crazy period irregularity under the age of 45, that should be investigated. Not with an at-home test. You need to go to the doctor. There are many different reasons that can happen. And the worst thing would be is if you did one of those at-home tests, it came back normal, but you actually had another medical condition. So you thought, oh, it's normal, it's like maybe super early menopause or something like that. So no, the tests absolutely have no value. And also, when we do want to do tests, we want to do blood tests. So people recommending those tests are being paid to recommend them, or they don't know the science, and I don't know which is worse.
Okay, I need to continue in this line of questioning because there are really influential OBGYNs on social media probably posting the virtues of at-home tests right now. So, as someone who is a big-time consumer of social media, how am I, the average person who does not have a degree in this, how am I supposed to navigate when I think this person is, for all intents and purposes, using science-backed data to inform all of their posts, and yet you're saying, don't waste your money, and somebody else says, absolutely, I put my name on this. So, like, how are we supposed to navigate that?
So what we recommend is, and this is a hard thing to do, is every piece of medical information that you see on social media, you need to get off the platform and you need to fact check it. And you need to go to a reliable source. And it's hard because the platform keeps you on. I've been on TikTok and all of a sudden it's an hour later and I'm like, why haven't I been watching Shark Attack videos? Or why didn't I just put Pride and Prejudice on? Right? So we've all been there, right? With the hand. Oh yeah, it's so sexy. Anyway, so if you know, you know. So you need to get off and fact check. The Menopause Society will tell you that you do not need to have hormone testing. So then you have a decision. Do you want to keep following somebody who is spreading false information? And my recommendation is you should block every single person who is spreading false information because there are people out there who are spreading accurate information. You don't need to contaminate your feed. If somebody is doing one thing that is false, then what else are they doing that's false? That's what I always think. So that's what I recommend. It's what I recommend in the book. People need to be far more liberal with curating their social media feed to protect them because people, if you're a physician, you have a duty to spread fact. Well, I think you have a duty to spread factual information. I think you have a duty to do that. But there are people who take money from drug companies. There are people who take money from non-pharmaceutical companies. And in the States, that's not trackable. And so, the facts are there. There's no recommendation from the Menopause Society to do hormone testing over the age of 45. And we don't recommend it under the age of 45 unless you're missing, significant amount of periods. And we want to check what's going on. So, people have to decide if people want to keep following people that spread disinformation. I mean, obviously, that's their personal choice. But, I was following somebody who I loved her fashion advice, and she brought on somebody who has a supplement company. And I was like, unfollow, block, done. You don't deserve my time. You don't deserve my time.
I want to get into a touchy area, but you do discuss it in blood, so I think it's fair game.
Okay.
Who exactly is qualified to give menopause care here in Canada? And conversely, who isn't qualified?
Yeah, so I think you want to see somebody who is, a member of the Royal College of Physicians and Surgeons of Canada. You want to see someone who is either, a family medicine doctor, an internal medicine doctor, if they have experience in those areas, or an OBGYN. You want to see someone who has, done a residency, who has gone to medical school, who, has that expertise. There may be some nurse practitioners and there may be some physician's assistants depending on the parts of the country, but that's who you want to see. I see a ton of disinformation from naturopaths. I'm very honest about the level of training that they have in the book. And, personally, homeopathy is a large part of naturopathic teaching, and that would be like teaching a pilot that magic carpets are real. So you have to decide, is that what you want to see? I wouldn't feel really great if my pilot said, I really loved my magic carpet curriculum. I'm not using it for the Airbus, but just so you know, I really love that. I'm just really honest about, who is truly an expert. And when you look at the training for medical school and you look at the training for naturopaths or the training for chiropractors, it's not anywhere, near the same. And, we just see there's been a lot of research, especially coming out from Tim Caulfield at the University of Calgary, about the kind of disinformation, especially during the pandemic, from, chiropractors and naturopathic websites. And I think people just have to be careful. There's lots of physicians who are bad actors too. So just because you're seeing a doctor isn't a guarantee. And that's why you really need to look people up. And I give examples, like if you see, Google someone's name and vaccines, if they're anti-vaccine, Google someone's name to see if they sell supplements, Google someone's name to see if they recommend tests that aren't covered by OHIP, things like that. Because there isn't any special menopause care that would be not covered by OHIP. That's different than not being able to get in because of weights, but all the tests should be covered. So if they're not, then that should be a red flag.
Okay, I want to quickly get into hormone therapy because, again, in 2024, we have access to more information, I feel like, than we ever have in the history of human civilization, and yet there are still myths that perpetuate about the safety of hormone therapy. So if a woman is suffering and she's looking for relief, talk to us about the safety and efficacy of hormone replacement therapy and who should and shouldn't be on it.
Yeah, so hormone replacement therapy, we call it menopausal hormone therapy now, because this replacement means that your ovaries are deficient and they should be replaced, and that's not, that we expect your estrogen levels to be low when you're in menopause, so it's not a replacement. It would be fair to call it that for somebody who's got, an early menopause, but for menopause, menopausal hormone therapy. It's the gold standard for hot flashes and night sweats, but there are also other medications as well for people who can't take it or don't want to take it. Can also be very helpful for prevention of osteoporosis for people at risk. Not everybody's at risk, and certainly exercise is also another important way to protect your bones. And then there are some other reasons that it's not recommended, but would be a valid thing to do in the context of after you have a discussion with a patient. So there is some data to show that it can sometimes help with joint pain. It doesn't help a lot of people, but it sometimes helps people. And so if you're suffering, it might be valid to try for 3 to 6 months. It can sometimes help for some people reduce the risk of type 2 diabetes, so somebody who's at high risk for that. It can help with depression in the menopause transition, but not actually after menopause. And so these sort of last 3 reasons are kind of what we call like yellow. I call them kind of yellow light indications. So the green light or prevention of osteoporosis and hot flashes, treating hot flashes and night sweats. It's FDA approved by Health Canada. We have excellent randomized double-blinded placebo-controlled trials. These other indications are kind of softer calls, but would be appropriate for the right person. Somebody who finds that their migraine headaches are worse in the menopause transition, be very reasonable to try. And then there are reasons we don't recommend it. So we don't recommend it currently for prevention of dementia. We don't recommend it for a standalone treatment for brain fog, although if brain fog is related to bad sleep, then it might help for that reason, right? And we also don't recommend it for prevention of cardiovascular disease. And all of these are available in the 2022 North American Menopause Society treatment guidelines. And they're also all available in the Menopause Manifesto for sale in the back, just letting you know. I pre-signed a bunch of copies for people to. And so, that's a good place to get information. Also on my blog, thevagenda.com, Vagenda with a J. I write a lot about menopausal hormone therapy and there as well, so people can get information. But you should be able to verify, everything that I said will line up with the 2022 NAMS guidelines. And so that's a good thing for people to have. The whole guideline's probably a little bit of a snooze fest to read, but I'm just saying. But it's interesting for me. But there's great summaries at the end of each section, and those are very easy to read.
And so the enduring fears of risk of breast cancer and stroke, where's the conversation at right now?
Well, so for people using transdermal estrogen, estradiol, which is kind of the standard of care nowadays, the risk of blood clots is exceedingly low. It's about as low as you can get. And unless you're somebody who is at high risk for blood clots, that's not something that we worry about. However, for people over the age of 65, there definitely is a concern about a potential increased risk of cardiovascular disease. So if you're starting at younger, then it's appropriate. And then what was the other part of the question?
Where was the second part of my question?
Breast cancer
risk,
thank you.
That's called perimenopausal brain fart.
No, it's called multitasking. There's a lot going on at once. And so for breast cancer, most of our data comes from the WHI study, which actually showed that Premarin, which is the conjugated equine estrogens, is actually by itself is not associated with the risk of breast cancer. But that's for people starting older. So the average age of that study was over the age of 60. And that's not really applicable to how we prescribe it today. The bulk of the information that we have is from observational studies with the transdermal estrogen, and so it's always hard to be definitive with that. We think the risk is exceedingly low with appropriate doses of transdermal estrogen. Some people say no risk, but again, that's based on observational data, so I don't think you can say no risk based on that. The progesterone component, there is a small risk of breast cancer associated with that, but the risk is less than the risk of having a glass of wine a day. And people look at risk in different ways. If you have no reason to take it, so if you don't have hot flashes and night sweats, you're doing fine, you're not at high risk for osteoporosis, there would be no reason to incur even a small amount of risk, right? Just like you wouldn't take a Tylenol if you didn't have any pain, there would be no reason to take it. But if you're somebody who's suffering with hot flashes or someone who's not sleeping well, then there are also health ramifications from poor sleep, right? So, it's all about the appropriate indication for the appropriate patient.
So are you in the camp that it's not to be used we should rebrand it, menopause hormone therapy, MHT, the idea of using it preventatively as sort of preventative medicine, is that where do you think the research is going?
No, that is not in any guideline. So I think that's really important. That's the whole reason why we did the Women's Health Initiative, to try to sort that out, because people were recommending it for that. We don't recommend it for primary cardioprotection for the heart, and we don't recommend it for dementia prevention. There's always more data coming out, and that's the great thing about science is if we learn more information, that will change. But currently, the Menopause Society doesn't recommend it for preventative therapy outside of people at high risk for osteoporosis.
Okay, so how early can you start it, and how long can you stay on it for?
Well, again, you would start it when you're having symptoms, as long as we felt those symptoms matched symptoms of menopause. So if someone's coming in and they're 41 and they think they're having some hot flashes, but their periods are really regular, I would be looking for other causes. So typically we start to see menstrual irregularities at the same time as symptoms, even minor ones, but we'd see them. So, if you're someone who's clearly in the menopause transition and having symptoms, you can start it. If you're in the menopause transition and not having symptoms, then you wouldn't need to start it. We don't have good long-term studies to tell us how long people can be on it safely. We think the risk is likely low, but that's based on we think. And so again, it depends what it's doing for you. Most people can reduce doses over time, and certainly risk is related to dose. So often when people start in their menopause transition, they might need higher doses that are more equivalent to the amount of estrogen that you get every day from an ovulatory cycle. But as you get older, you don't need that dose anymore. And so, people always want to try to explore lower doses and see, and also what's it actually doing for you. Like any medication, menstruation, it should be periodically reassessed. But there's no guideline that recommends it currently as preventative therapy, and if that changes based on good quality science, then it'll change. But I don't think we have good quality science to say that. Otherwise, the guidelines, which were just updated a year and a half ago, would reflect that.
Okay, just a few questions left because we have, I'm sure, a lot of audience questions.
Sure.
We've been talking a lot about menopause, and we always say it with like this, oh God, menopause. Are there any upsides
Sure.
to menopause?
So first of all, it's really awesome not to have a period. It's really awesome. It's really awesome not to have like breast tenderness that comes with your cycle, or period diarrhea, which is what I had. Oh yeah, my old friend, sure. My frenemy. So those things are all great. And then a lot of women describe a clarity in menopause once it's all over. And I think that, kind of the chaos, and we don't really know why. I mean, it could be just you don't give a fuck anymore. That's a possibility. It could be that it is so liberating to be not of interest to the male gaze. It could be that. Right? And it also could be the fact that, your brain prunes pathways it doesn't need anymore. And during your menopause transition and early menopause, you're getting rid of pathways you're not using. So all of the hardware wiring in your brain that's part of telling your brain to ovulate, all of that stuff isn't needed anymore. And so, does pruning of those pathways leave other room for other things? I don't know. I don't think we know the answer, but I think it's really good for people to hear that so many women say that they have this clarity in menopause, and they, this is the best they felt their entire life. Maybe it's because they're just not having the awful cyclic changes. I don't think we have the answer to that, but I think it's really good for people to hear that that club menopause can also be awesome.
Club menopause.
Club med, yeah, exactly.
Last question. I know you have a son or sons?
I have two sons, yeah.
Two sons.
Yeah.
But if you had a daughter, what would you have taught her about menstruation?
Yeah, I mean, I would have used all the medical words. I would have spoken about the vulva and vagina in, not you just like you would, and using, non-sophomoric tones, explaining it's just part of your body. I would have used the same tone of voice for the elbow that I use for the vulva or vagina. I'd be like, here's all the range of menstrual products. What would you like? What interests you? I think that while I don't have daughters, my sons actually know a fair bit, I have to say. I'm always getting texts from my son in Ottawa about I told my friend that she should get ibuprofen. Is that the right thing to do? And I'm like, yeah, it sounds like the right thing. And I have to say, he's very proud. He called, these are his words, he's a platinum gay. Because he was born by C-section, so he's never touched a vagina. It's pretty clear he's my kid, right? And he's really proud that he knows all this stuff. I'll tell you a really funny story. I bought some menstrual pads to do this experiment to show people how they don't absorb water well, to show the difference between incontinence pads and menstrual pads for absorbency, because there's a big difference. You need to use incontinence pads. And they were sitting in the bathroom, because I just bought them and put them there, and he comes up and he goes, "Mom, are you okay?" And I'm like, "Yeah, why?" He goes, "Well, I saw you bought those pads, but you stopped your period. Are you?" And I was like, I thought that was really sweet, right? He was about 16. So I was like, "Oh, it's for a video." He's like, "Oh, okay."
It all makes sense. I'm going to turn this over to the audience.
Great.
It has been phenomenal. Thank you for letting me pick your brain.
Thank you.
We just scratched the surface.